Welcome to Diplomatic Passport, the daily weekday COVID-19 show that keeps you up to date with developments the world over, in the region, and of course in Zimbabwe. This is Zimpaper's television network, and I'm Robin Kundiwa. Now, let's start by taking a look at the latest COVID-19 statistics in Zimbabwe as of the latest data released by the Ministry of Health and Childcare. So Zimbabwe now has 4,395 confirmed cases, including 1,264 recoveries and 97 deaths. 56 new cases of COVID-19 were recorded yesterday. Now, these are 54 local transmission cases, a returnee from South Africa and another from Zambia. Today, we regret to announce 13 deaths. These include 9 males and 4 females from Harare. To date, the cumulative number of people tested stands at 144,490. Harare, of course, is still the epicenter with 1,550 cases, followed by Bulawayo, which has 531 cases. Now, as humans, we are sometimes a danger unto ourselves. The COVID-19 has given birth to what is now known as the under-the-nose community. Now, this is a group of people that just wear masks because the law requires them to do so. Well, a study has shown that the nose is connected to the lungs. We therefore put ourselves at great risk of a direct infection when we do not wear our masks properly. That is over the nose, not under the nose. Now, Dr. Joseph Varon said such people with the ignorance are the reason, of course, behind that surge in the COVID-19 cases. He said because of such people, we are now fighting two wars. A war against COVID-19 and a war against stupidity. Now, this frontline doctor in Texas is absolutely displeased with anti-maskers.
Pretty much fighting two wars. A war against COVID and a war against stupidity. And the problem is that the first one, I have some hope about winning, but the second one is becoming more and more difficult to treat. And why do I say that? Because people are not listening. Whether it's, we're backed up by science or just plain old common sense, people are not listening throughout the country. And what is probably the most disappointing thing, the thing that annoys me the most, is that we keep on doing our best to save all these people, and then you get another batch of people that are doing exactly the opposite of what you are telling them not to do.
Now, back in Zimbabwe, Zimbabwe's major retail chains say they have been forced to temporarily close shop in the wake of surging COVID-19 cases. Now, the Confederation of Zimbabwe Retailers President, Denford Mutashu, told ZTN that retailers and wholesalers have been affected, adding that manufacturers are also catching cold. He said of the operational retailers, most are operating with very lean staff.
Collecting the data, but some of the big chain stores are actually have shut down 50% of the branch networks. And we also continue to receive information from quite a number of other players that have also sought advice on how they should proceed, and we've advised them to actually temporarily shut down and take all their employees for COVID-19 testing, because so far, even those that are operating, we do not know whether the employees are safe from COVID-19 or not. So we've advised them to take their employees for COVID-19 testing.
The retail industry there catching cold. Now, some residential areas in Harare have not been receiving normal water supply, if any, for the past few weeks, as the local authority is failing to produce enough water to meet consumption demand. Now, the town clerk, Hosea Chisango, told ZTN that council is failing to procure enough water treatment chemicals due to a huge debt owed to suppliers, Chemplex Corporation.
we currently have a situation, a water supply situation, where we've been battling with the amount of chemicals that we are getting. The reason is that our chemicals, the cost of our chemicals is going up every day, and we have accrued a debt which we are still trying to service. We have, however, engaged our main suppliers of chemicals, who are Complex Corporation. We discussed with the management team there, and we have agreed that we can lock part of the debt, and then we continue to do our weekly payments that we can afford at the moment, and then we'll continue to supply the chemicals, while we also approach government, as we have always done when we come to situations like this.
Now, as part of the guidelines set out by the World Health Organization on prevention of infection of COVID-19, washing of hands regularly is highly recommended. But in a world where access to water has been an issue for quite some time, what do we do? Can we follow the guidelines by World Health Organization when we do not have running water in our homes? Well, we got in touch with the Harare City Council chairperson for the Environment Management Committee, Councillor Kudzai Kadzombe, to tell us what has been the major challenge and what they have been doing to address these water problems during this time of COVID-19.
What we have actually done is, you understand that during the lockdown, no one had prepared for the COVID pandemic. And, you know, as a council, we are no exception. We also then were affected in terms of our revenue collection, as council actually depends on rates paid by the residents for us to be able to operate. So the decline in revenue affected us with an ability for us to purchase chemicals to treat our water. Our main local supplier, Complex, have also been affected in terms of production of the required chemicals that not only the city of Harare requires, but most local authorities in the country of Zimbabwe have also then been affected by it. So what we've done is we've done a position paper together with Zimforce, which is also Complex, to government to actually ask for financial bailout using the COVID-19 funds, so that we can be able to give unlimited supplies of water to our residents. As you know, water is life and water is a necessity, and you know you cannot do anything without water. So this is the predicament that we're facing as the city of Harare, and as well as chemical suppliers in the country.
Now, the same water shortage has been a persistent problem in Harare, to a point where communities have offered their labor to assist with some of the projects by the city to improve water supply. Like Councillor Kudzai Kadzombe explained how this community engagement initiative is going to be rolled out.
Hopefully it was a pilot project, and we wanted to see the response that we get from the residents, and we actually saw that the response was overwhelming, and residents are actually willing to come through and partner with council with the manual labor in return for exemptions on bills and payments. So it's something that we actually then going to then roll out across the city, as we've seen that the residents are willing.
Now keep posting your comments with regards to this issue, especially around the provision of water. Are you getting water? When was the last time you received water from the City Council? Of course, these are things that we need to hear from you as we move forward, because in this age of COVID-19, we absolutely need water, and we need to hold those in power accountable to make sure that we have something as basic as water, especially at a time of COVID-19. Now, cleanliness and access to basic services like public toilets is another key thing at such a time as we are fighting a virus that calls for cleanliness. Now, Copacabana traders in the city in Harare have partnered with the city of Harare to revamp toilets near Copacabana bus terminus in an effort to decongest the ablution facilities, after they had seen how women had to stand in long queues before getting their turn to use the current facilities, which of course were now stretched considering the population of citizens. We spoke to one of the pioneers of this project and a beneficiary to understand how this initiative has benefited both the traders and the community.
The Copacabana Traders Mall takaona zvakakodzera kuti tikwanise kuextenda toilet yepaCopacabana yeruzhinji, because takaona kuti vakadzi vari kuita problem yekushandisa maablution because mafacility acho mashoma. Saka we've done it as a company tikati ngatingobetsera city of Harare nevanhu veruzhinji kuti vakwanise kuwana kushandisa zvibudzi zvakanaka. Zvatakaita muchitarisa view yangu kumashure kuti tine mall yedu yatakavaka state of the art inohauza vanhu vakawanda. Saka ine matoilets ari modern and anokwana futi vanhu vese varipo. Saka in the meantime tichivaka tichivaka vanhu vachange vachiuya vachishandisa mablution edu munomu in line nemacovid regulations. Tine vakomana vari pama-entry points ese vanenge vachitora matemperatures, vachicheka matemperature, vachisanitize vanhu. Ndo zvatiri kuita in line neWorld Health Organization nemutemo wehurumende, uye tiri kuvhara na 3 o'clock tichitedzera zvakataura president.
Kutenda nezvatiri kuitirwa nevakuru vedu vakaita kuti zvinhu zvatiri kuita izvi, munhu wese achipinda pano pagate atanga kugezwa maoko ake, osanitizwa maoko ake achipinda muno, and zvinhu zvedu zvabva zvachinja pakuvhara kwatakaita panapa. Nditoona chero upenyu hwangu hwachinjawo, ndikuzvifarira ende ndotoenda Mwari kuti Mwari aramba achitikombera zvatikaitirwa nevakuru vedu vari panapa. Chero matoilet edu atoshandisa awo nemaglasi mamira edu kuti tizvionewo nematiles aiwa achava chirungu handikutombori.
The beauty there of the community coming together to make sure that they rectify problems and not just sit on their laurels and wait for central government and the authorities to make sure that they fix things. Of course, some of you may be looking forward to that absolutely long weekend that we enter today in Zimbabwe. Of course, it's Heroes and Defense Forces Day next week. And of course, that's going to be all lumped into the weekend. So until after that weekend, I will be joining you yet again. And I suppose that will be Wednesday. And of course, we should have gone through all the emotions, all the paces. Unfortunately, this time we don't have that luxury of going around and seeing family, because a lot of times this was the holiday where we'd go out there and deal with the little formalities of being born into families, you know, those tombstone unveilings and all the likes. But this time around, because COVID-19 has grounded us, we're grounded at home. So let's find what we can do with this time on our hands. For those of you who are critical staff, and of course, we're going to work, like me, you're going to be relishing a bit of a rest. And for those of you who've been at home all the while, we're coming to join you. And we're going to be together. We're going to stay safe. We're going to make sure that at least we make the most of this holiday. That's been all for today. Now keep your contributions running onto my Twitter handle at Zimrobbie, that's ZIMROBBIE, or my email address on robinkandiwa@ztn.co.zw. Please send through those pictures, those little videos of you and how you're going to be utilizing this holiday as it comes. So from me, Robin Kandiwa, and from the team behind the scenes, Steve Chivari, my TD, and of course the entire team, thank you for staying at home and staying safe. Have a great long weekend.